Hello, everyone. It's good to see some new faces. Well, I guess I couldn't say the faces. It's good to see some names that we don't always see. Some of our coordinators coming in. That's great. Some of our core members, some of our women-led organization core members. So it's good to see a variety of people. And nice to see Pep here, who was part of our mission to Ethiopia. So definitely, if people want to add things, they're welcome. So I just wanted to let you know, we did have a bit of a break over the summer. We didn't have a call in August. And we did put 2 hours into the agenda, and I know that's a very long time. So I just wanted to let you know, we are going to try to keep it close to an hour and a half, but I wanted to let you know in advance that it might run over a little bit. There's a lot of emergencies going on right now. And it often depends on how much discussion that we have. So, you know, I know sometimes there's a lot of questions. So just so you know, we are going to try to make it less than 2 hours. And then if some of you need to jump off after an hour and a half, which is the usual length, we understand that you will jump off, but others might want to stay on if we're running a bit over. So we're going to start today with Esmeralda from DRC. And I also actually just want to say, Anita, who's been our coordinator in DRC, is actually leaving that position. So I just wanted to let everyone know who has worked with Anita. She's been amazing as a coordinator in DRC, and she is moving on to become a deputy rep in another country. So I just wanted to give everyone a heads up before we hand over to Esmeralda. And to say that Esmeralda has also shared the information on brothels in North Kivu in the camps in East and Southern Africa, and as well as to the coordinators group. So she's going to present about the situation, which is quite worrisome. And at the end, I've also asked her if she could say a little bit in response to the article that has been circulating from the Wall Street Journal. So handing over to you, Esmeralda.
Thank you so much, Jennifer. Hello, everybody. I will keep my camera off just to make sure that the internet is still on, the internet is still working. Thank you for giving us the opportunity also to introduce the work that has been done in the DRC. Next slide, please. So as many of you know, the DRC is actually one of the most severe and complex and neglected humanitarian crises that we've seen grow globally. So many people has been plunged into the insecurity. So when we term in terms of insecurity, either food security, but also we're talking about protection as a whole. So the province that are mostly affected in the eastern part, so it's North Kivu, South Kivu, and Ituri. So because we have seen escalated clashes between, as you may have heard, the M23, but also other group. So around 25.4 million people are in need of humanitarian assistance as a whole. And in the North Kivu province alone, there's more than 2 million displaced people. And the other aspect that's very specific to the North Kivu is that about 500,000 of these displaced people are actually around Goma, the city of Goma, where we'll see later the impact directly on the impact that we can see also in terms of gender-based violence. The other aspect also that's very important is the dire situation in terms of humanitarian assistance, because unfortunately, most people are living in a makeshift shelter and makeshift tent. And every other day, we see more and more tents being popped alongside the road, but also isolated area. And as we all know, these are actually the aggravating factors in terms of GBV. The other aspect is in the DRC, unfortunately, gender-based violence remain really a very complex and serious situation. In North Kivu alone, for the first semester, there were over 27,000 cases being reported that has received services in one of those service plans, either medical, psychosocial, legal assistance, or economic recovery. And unfortunately, we know these cases do not even represent the whole reality, because in terms of a fear of reprisal, lack of access, humanitarian access, and also the fear for community stigma, these are all of the reason why we see it's very complicated for some survivor to access the service. So with all this, one of the things we've seen also is the brothels is something that's come up over and over again. And in a humanitarian context, we need to understand that the main driver for women to engage in transactional sex are food insecurity, extreme poverty. And this is the same thing also that we've seen as well in the North Kivu. So we see the access to basic need and livelihood also have been interrupted for a long period. So behind this whole context, it was very important for us to understand as the GBV or as humanitarian actor, what are the impact of those brothels? What are the impact of all these components actually on the needs of women and girls? Next slide. So, and also one of the things we need to see is that this is not a new phenomenon in the DRC, and specifically in North Kivu, because the first alert that we have about brothels was back in 2016. But as I mentioned previously, we've seen there has been a proliferation of brothels, and also the number of people, of women and girls who has to, the number of women who engage in those survival sex also have increased, given the fact that the humanitarian assistance is not enough. So this is why, as the GBV AoR, with all the actors, we've seen it was very important for us to have a better understanding of this issue. So then that way we can find also the best way to respond in terms of protection, but also in terms of health. So that's why this study started the end of last year. And to ensure that there has an ethical approach to it, it was carried out by 2 independent consultants. Assess the extent of gender-based violence, including the sexual exploitation and abuse of women and girls in those brothels. So that way we will have the understanding to have a better and appropriate response. The other aspect also, it was to describe the social demographic characteristic of the women or the girl who was being exploited in this brothel. And it was very important for us to make it clear to everyone that when we talk about minor, when we talk about girls, we're talking about rape, we're talking about exploitation, because as they are minor, we cannot say they have been engaged in survival sex. And the last was also to do the mapping, because often we were going to the government to request also that they put in place the mechanism to protect the women and the girls. And one question that come over and over again was, where are those brothels? How can we share to know where to close these different brothels? So those were really the 3 key objectives that we had for the study. So the aspect, next slide, please. In terms of the methodology that was used, and I'm gonna go very quick on this, it was very important for us to talk with the community. So in order to do so, on top of the 2 consultants that I mentioned, the whole process also was co-led with the Gender, Family, and Children Division, because we wanted also at the end, the result that we'll see will be taken by the government, by all the actors, to make sure to understand we need to work collaboratively to find a solution to this issue that has been around for about 10 years or over 10 years. So in general, there was more than 30 stakeholders, either ING or NGO, local organization, but also government and agency who took part in this process. So to the end, we had the focus group, more than 26 focus group, because also one of the aspects, it covered the whole province. So meaning the 6 territories and the 3 cities that comprise the North Kivu province. So all of these territories and area were covered by this study. The other aspect also, it was very important, it's to have the people from those different actually from the different territories because they have a better access to the community there. So in total, there has been more than 26 focus group, as I mentioned, but also there has been over 100,000 either individual or semi-structured individual interview that happened also with key partner, key stakeholder, either women-led organization, either other individual that we know can actually provide the information as key informant. Next. The other aspect also that was very important is the criteria for participation, because since it's a very sensitive topic, we wanted to make sure that we respect the do no harm, we respect also the guardian principle. So that's why the criteria for participation was either someone that's engaged themselves in survival sex or who are owner of brothels. And it was clear also for them to understand what is an informed consent. So any information that they will be providing could be used to a certain extent to showcase the situation that we're trying to understand. So that's why also in terms of category of people, we have, of course, the local authority or either the community leaders or the administrators. We also had the religious leaders, civil society, informal and formal group, as you see, but also the IDP themselves and the women-led group that's found also in this different IDP site, also in the territories. The other category was, of course, the women and girls. That's the main activity was survival sex while we were doing the study. Next slide. So to go very quickly, some of the key findings that we've seen. The first aspect is that most women and girls that are being exploited in those brothels, it was a matter of poverty. So the fact that they cannot respond to their needs, to their basic needs, or to the needs of their family, the household. So it was very difficult for them to find other ways, other livelihood options. So that's when then they engage into these brothels. The other aspect we've seen also is often they have been misled by the managers of this brothel, and especially the young girls. They will be engaged as a waiter, but unfortunately, as soon they will be there, they will be sexually exploited by the clients of those different bars or different places that's being recognized as a brothels. The other aspect also, it was very important for us to understand when we're talking about brothels, where are these brothels and where are these abuse are happening. So we've seen there were either home, there was the hotel, there was the bar, but also the other component that was quite surprising, it's also the unoccupied tent. So this is something that was very important for us to find. And that was very worrying, because what we've seen is sometimes when there are tents that's no longer occupied by some family, then they've been changed into brothels where women and girls are being exploited on top of those bars that's being put in place in those IDP sites. The other aspect also that was very important, we've seen the direct link between education and the vulnerability of these women and these girls. One of the things we've seen, 55% of the women that were exploited, the girls that were exploited, had no level of education whatsoever. 23.4% of them only had primary education and 20.8% secondary education. So we see also the link on the fact that they cannot find also other type of livelihood with the very low level of education that they had. The other aspect also we've seen is the exploitation specifically of the minors were facilitated by intermediaries. So either the owners of those brothels, but also we've seen sometimes it's the parent themselves that will actually bring some parents or guardian also that will actually put the girls, the little girls into engaging in survival sex, and they've become those victims. And the other component that's very important is 70% of the money that were paid by the perpetrators actually went directly to either the owner of the brothel. So in reality, despite people doing it to better their condition, to have a better livelihood option, at the end of the day, it's a complete denial of resources and opportunity for them. The other aspect in terms of profile of alleged perpetrators, it was also important to understand who are those people that are going to those brothels. And what we've seen is actually everybody, everyone and nobody at the same time, because the profile is so large. We have the internally displacement themselves, we have the host population, unidentified men, the site managers. And one of the things that was very surprising, but at the same time we speak very loudly, is we have also humanitarian actors that still go to visit those brothels. So this also gives us an opportunity to think differently what can be done in terms of prevention, what can be done with these men and boys to understand actually the impact of sexually exploiting, of raping these young girls in those brothels. So the other aspect we've seen also, I see already the question, we ask ourselves also, how come there's no mention to a certain extent of armed group, especially in the context we know there's quite some conflict-related sexual violence. And one of the things that we've seen also, there's that fear of reprisal, especially that some of those brothels are actually being owned by other armed group or any other armed person. So that's personal. So that's why also there was that fear for people to mention and the alleged perpetrators any armed group or anyone from the national force or so on. So in terms of consequences, as you can imagine, there was a lot of mention about unwanted pregnancy, but also the high level of sexually transmitted disease, the STDs that we've seen also, but the complication of unsafe abortion. And this is something also that was very important for us to find out, because unfortunately North Kivu and Ituri remain some of the places where the rate of maternal death is very high. So to know also some of these women who get unwanted pregnancy from from being raped from this brothel also have access, and we need to take into consideration when we improving the risk component. Of course, this emotional and physical violence. You know, when there was the interview, it was not rare to hear from the interviewee, from the women and girls, that sometimes you think you will have one client, but at the end of the day you find yourself with 3 men in this little room, or sometimes it's not even a room. You could see the IDP site for people who are familiar with the IDP site in Goma. Issue is the number of brothels that were in North Kivu.
Esmeralda, you're cutting in and out. Maybe try turning off your video, and then if you can just back up a little bit, because you were silent there for a few, not a long period, but just a little bit.
Is that better now?
Yeah, let's see how it goes.
Okay. Yeah, I thought actually I turned off my video. I just realized I didn't. So the other aspect also, next slide please, was the number of brothels that there were in North Kivu. So we find that there's over 1,063 brothels that were identified. And I really want to put the focus on identified, because we know also there could be more, but unfortunately we don't know where they are. The other component is the link that we can make directly to where we have the concentration of those brothels and where the need for displaced population is really high. As I mentioned at the beginning, we've seen Goma. It's one of the city or territory where we have the highest concentration of IDPs. And to no surprise, we've seen also this is where you find the most number of brothels. After you have Ruchuru, you have Masisi, Lubero. So all of those places, this is where you have a very high concentration of internally displaced persons. And the other aspect is to see more and more, unfortunately, brothels are being seen as an economic driver. So for people who do not have any other livelihood opportunity, so now they see the brothels as, okay, this is a viable business, because at the end of the day, we know we'll always have a client. So this is also something that was quite interesting to find, because we can see the direct link between the insufficient assistance and also the number of brothels that being in those different territories and in area. Next slide. So following all of these, there were some key recommendations that we put out there with all the stakeholders. The first was also to reinforce the leadership and accountability of the authorities. The reason why we put this as central is because, unfortunately, often we've seen we rely on humanitarian actors to find solutions. But as humanitarian actors, we cannot go and close those brothels. We cannot go and arrest the owners or the perpetrators. So that's why we really wanted to put to ask for the leadership and the accountability of the authorities, but also the humanitarian and development actors, because we've seen there's a direct link between the insufficient assistance, the dire situation in which the people are living, and also the fact that the proliferation of brothels. So we really wanted to see how we can tackle this issue as humanitarian actors, but also as development actors. Because when we talk in terms of livelihood, unfortunately, as humanitarian actors, we do not have the capacity to respond to those needs. The other aspect also was the financing, the prevention, GBV prevention initiative and humanitarian setting. Because one of the things that we've seen and that we have been doing a lot of advocacy is how we can finance more GBV prevention. So how we can work better on social behavioral communication change, how we can work better with men and boys so that they understand actually the direct impact of those sexual violence, gender-based violence on women and girls, and how we can as a community also find some longer-term solution, because the situation in the Eastern Congo, it's been over 30 years, and it's not, unfortunately, the first time that we hear how dire the situation is in terms of sexual and gender-based violence. So that was some of the, after we really declined these recommendation for specific aspect for the Ministry of Gender, the presidency, etc. But for the purpose of time, this is really how we summarize those recommendations for this study. I think this is the last slide in terms of this study. No, so basically these are what I was mentioning. But I'm sure you have the presentation so you can see. But one of the aspects also was the fight against impunity, because we've seen this is a very big issue in the DRC. And to illustrate, the example we provide is like for every 100 cases that receive medical care and psychosocial care, less than 5%, so less than 5 women receive legal assistance. And if we go to the extent of having actually to going to the tribunal and to have, it's less than 1%. So the fight against impunity is really important in order to increase the legal measure being put in place. But also it was very important to strengthen the protection mechanism, not only for the victim, but also for the organization. Because one thing that we have seen is the reprisals, not only against the victim, but also against the organization that has been voicing the issue in North Kivu. And this is one of the reasons why, as the GBV AoR, we wanted to be at the center with the government, so that way we can reinforce the protection of those organizations also working in this topic. And again, we've asked for strengthening the economic resilience, because one of the things for people that know, last year we had a scale-up declaration, and one of the key components was directly linked to GBV, but unfortunately the funding did not follow. especially in terms of economic recovery, economic resilience. It did not follow. And all of these are aggravating factors, actually, of all these number of cases. In any other setting, hearing 10,000 cases for the whole country, everybody would be outraged. And now we're talking about over 27,000 for one semester, for one province. More than 50% of sexual violence, and unfortunately, we don't see the outrage the way it should be. So that's why also it was very important for us as GBV AoR to show the link also on those sexual exploitation and brothels, but the overall GBV situation in North Kivu. I will stop there for this component. If you could put the testimony, yes, so people, if they want to read and.
Thank you so much, Esmeralda. There are some questions in the chat. April was just asking you about, she's from OCHA, and she was asking about the 27,000 cases that you mentioned, and she was asking which period was that? Like, what are the dates? I think you just said it was in a semester?
Yeah, January to June.
Of 24?
Yes, 2024 for North Kivu only. Because if we took the country as a whole, it's over 60,000.
April, did you want to follow up on anything else on that? Okay.
Hi, thanks. No, I just wanted to clarify.
Okay, then you have a question. I know you answered one that you saw. There was a question by Karam from WFP asking about if there's any indication of any form of online prostitution or any signs of abuse reported.
So it's not directly linked to the IDP side, but unfortunately, one of the other aspects that we've seen more and more in North Kivu is sextortion. So there's a lot of sextortion happening, especially with the youth, especially like, it always unfortunately goes back to when you don't have the means to take care of yourself, then you are more vulnerable to all of those type of gender-based violence. And in that end, it's more the sextortion that we've seen, not so much, if we could say, on form of online prostitution. That would be more in the capital, Kinshasa, that there has been some cases, but it's really more the cyber violence and sextortion that we've seen, especially for the university or for the secondary school.
Okay, and then I think you answered already about the armed actors, connections between armed group members and other men who are perpetrating violence. Yeah, you talked about impunity already. Are there any, wait, I just see one new message. Any findings on women and girls with disabilities, seeing that in some communities, persons with disabilities tend to be excommunicated and thus increasing their vulnerability? Did you have any, like when you were doing the research or anything, did you have any sort of segregation?
And that's why we wanted to more clarify in terms of.
Oh, you're fading in and out. Can you start over with the answer, Esmeralda?
Sorry, the connection is not good.
Yeah.
So what I was mentioning actually is that we had some women and girls with disability as part of the interviewee, but we did not go in detail to having the number of women and girls with disability being exploited in those brothels, and the reason for that also was a matter of security and safety for them. But part of the interviewing, yes, we did have women and girls with disability.
Great, thank you. And Constance from UNHCR is asking about collaboration with MONUSCO and also with colleagues around prevention.
Yes, And then just one of the things we've done in terms of is to have a joint action plan with MONUSCO, but also the other civil affairs component of the MONUSCO in terms of prevention and what can be done also to increase the security and the area where we know the high concentration of sexual violence, especially when women and girls are going to collect firewood or to fetch water. So there is already an ongoing collaboration, but also as we are in the process of the disengagement of MONUSCO, it's also to see what can be done to reinforce what has been done already. So then we don't see a void when this disengagement will happen.
And I had a question. You talked a lot about how you engage the government in the research and the study so that they would also work around response and assume prevention. So I'm just wondering, was that successful? Like, what kind of response did you get from the government that you engaged?
So basically, the response was quite positive, and the sense now it does not look like this is a GBV AoR or this is the humanitarian actors report. This is a report that actually even the government will understand. And the last slide actually it was about what are the key steps, the ongoing action, and one of them actually last week we revised the provincial action plan on the prevention and the protection of these exploitation and brothels. And basically the government also is at the center, especially for the aspect of protection and the aspect also of the fight against impunity. Especially as I mentioned, that sometimes they mention some of those owners have link to some authority. So it was very important also to have them engaged in this company.
And sorry, just one other question. You mentioned that, there's not the outrage that one, I mean, I think there was around this article that came out, at least it sounded like New York. I don't know if April or Constance or someone want to say more, but are people in DRC outraged? Like when the government was learning all of this, was there outrage expressed by them?
Actually, it was it's a anxious laugh, if I could say, because one of the I think when I talked to you also, Jennifer, yes and no, because often in the DRC, as soon there's article or there's anything that mention numbers, and if we know those numbers do not respect the validation process that's being put in place, there's a lot of question about the validity of these data. So that's why, as the GBV AoR, we also had to talk with even the Wall Street Journal in terms of the worries that we have in terms of the risk of reprisal for these survivors, because there was name of the sites where these women and these girls were, and not last in June, the Child Protection AoR and the GBV AoR, we actually published an advocacy note, an information note about the risk of reprisal in North Kivu, because we know how many armed actors, armed groups that we have in North Kivu. So that's why also, to that extent, it was something very important for us to highlight once again that the situation, unfortunately, is as presented, but we cannot confirm any data than what we know that has been validated. But in reality, it's not rare that we have women mentioning, and even the mention of the 12 of the 13 girls had mentioned they have been raped. It's actually from that note, that advocacy note that was published by the Child Protection and GBV AoR when we had this focus group during a safety audit. And the reason why we amplify this is like, usually at that age, young girls should be thinking about their prom, but the way they present it is like, we just waiting to be raped again. So that's why also we wanted to really put that focused and to really showcase this is what we're going through. This is what the women and girls in North Kivu, but also in the Eastern DRC are going through because of the context.
And now Justin, who is, I'm assuming from Child Protection, because he's asking, how is the collaboration with Child Protection? I mean, you just mentioned that you did this advocacy note together, but there was a question about how you're working together with Child Protection in terms of adolescent girls impacted. So apart from the advocacy note, is there anything else you want to add?
So we're working very closely, especially that about 38 to 40% of the victims that we mentioned actually are minors. So we do a direct link in terms of the referral pathways, but also in terms of joint programming, so that we make sure that the needs of women and the girls are taken into account. And the other aspect also is in women and girls safe spaces, what can be done collaboratively with Child Protection and all the actors of CPAOR and preventing, but also in providing other means for the women and girls. One of the aspects we did not mention is the menstrual hygiene. And this is actually one of the things that was mentioned for girls, adolescent girls to go to the brothels. It's because they can't even respond to the basic menstrual hygiene needs. So yeah, it's very complicated and complex.
Well, we have a few of our core members on the call representing different agencies. So it's good to get this message out to the group here. And then Constance just asked, she said it was very important to hear about this advocacy note and was wondering if you could provide a link in the chat, or if not, send it to us so we can share outward together with your PowerPoint. That sounds really important. I know there was also a question from Christine about the bylaw, but I also realized we need to move on because of time. But I don't know if there's something quick to respond to Christine, because Christine, I don't know what bylaw you're referring to. I'm guessing Esmeralda will know, but maybe you should say what it is to others so others understand.
Esmeralda, thanks for the great presentation. I think there was some sort of a law passed at the level of, by the government in Goma around the brothels, like outlawing the brothels. That's what I mean. What progress has been made in terms of its implementation? Because your presentations really shows that the situation seems to not have improved.
So basically, it was an arrêté of the mayor at the level of Goma. And one of the key recommendations that we've made also, it was how they can put it at the provincial level. And to do so, given that we have a military government, so there's a discussion with the military government to put it as a provincial measure. It was basically for the closure of those brothels. But one of the mention, during the discussion with the governor, one of the issue we have also is the fact that those brothels are not how we will imagine them. As I mentioned, some of them are in the tent. So that's why we see there's need to be collaboration with the CCCM, with the protection cluster, with all the other PNC, the National Police Force, so that we can have a collaborative approach. Because just saying closing them when
Just to remind us that this is a presentation.
They are in so many different, it's quite difficult. But so far there has been, sorry?
No, keep going.
Yeah, but I was saying there was only 13 closed, and if we think about 1,063, so it's only a drop in the ocean, but we hope for more progress. Over to you.
No, I was just saying you've been broken off and on, but it's just to remind us that you're presenting from the field. That's what I was saying, because you've faded in and out. But thank you so much. I think this is really a very tragic story, and you've done a really good job of putting this together and informing us. So we will share this out, and I think we definitely need to talk about, with you, what else we can do at the global level. It's so hard, right? Because countries like DRC are not getting visibility, and yet the issues are, reason for total outrage. And it's worrisome that that we get these figures and somehow we're, the globe has become desensitized. So now, actually, when we have the questions in the chat, I'm talking too much. But thank you for that. We're gonna move now on to Ethiopia, and I see that Pep is on the line. I haven't seen if anybody else from our mission is here. Just to say, with the Global Protection Cluster, we did go to Ethiopia, and it was all of the global level coordinators from the 4 AoRs, so Housing, Land and Property, Mine Action, Child Protection, and GBV AoR, together with Pep, who's the new coordinator, a little less new now, but still fairly new, from the protection cluster at the global level, who is online. And just to say, we did meet, this is our third mission. I just should put that out there. We went to Somalia, and then we went to Ukraine, and this is our third mission. This is also one of the recommendations put out by UNHCR to have us go on more missions together. And I have to say, we were very impressed in Ethiopia to see how well the different AoRs and protection are working together. And the last question for DRC was how are child protection and GBV AoR is working together. Definitely in Ethiopia, they are also working well together, and together with protection overall. So we did start off our mission with a meeting with the humanitarian coordinator, as well as the head of OCHA in Addis. And so that started us off, I think, on a very positive track. And during our mission, we met with a variety of actors from government, the Ministry of Social Welfare, with the ICCG, with the Ethiopian the Ethiopian Human Rights Commission, with NGOs. So we met with a number of different actors also from the regions. We went to Tigray, to Shire specifically for 2 days. We also talked to donors at the end. We got to go back and debrief to the humanitarian country team overall, and meet again with the humanitarian coordinator as part of our debrief. And some of us went on parallel meetings. The person from Mine Action had a meeting with the global, with their staff were on a retreat. She was able to go to that. I was able to, in Addis, go to part of the mid-year review of the GBV AoR and see the different actors, as well as in Shire, meet with the GBV AoR group. There were also visits to one-stop centers, to women, girls, safe spaces, to child protection, child-friendly spaces. So we really tried to do quite a bit. It was ambitious for 5 days. And of course, we can never go to the level we want. And I also wanted to just say, it was made very clear by the humanitarian coordinator in our first meeting that it was important to go to Amhara, which is where there's a lot of conflict going on now, and which is really not getting visibility or media attention. A lot has gone to the north and now to contested areas, but particularly in the west of Amhara, there's a terrible situation that isn't getting attention, and access is the reason that we did not go. We tried very hard, and at one point UNICEF was able to get authorization to go, and then because of a storm, the flight was canceled. So we tried, and we did actually just meet with them this morning. And we also met online with OHCHR, who was on leave when we were there. So we have continued with a couple of sessions since the mission. And I have invited also our 2 coordinators from Mekele and from Shire to this call, because I think it's always good to give the opportunity from our colleagues in the field to present. But just to say, in general, you know, there's a lot of questions around IDPs who are being pressured to return to their homes of origin, but are finding that their houses are occupied or their houses have been destroyed. We even heard of a story, you know, of someone who found out that was living in somebody's house, found out that people were returning and destroyed the house and then left. So people who did return without it really being voluntary, didn't find any of the promises kept by the government in terms of there was still not safety and security, no education, clinics not functioning. So they went back to Shirde. So we met some people who are double IDPs. And this is an ongoing issue. It was very clear by everyone we spoke to in IDP camps that they want to go home. And the conditions that we saw are just really atrocious. You know, dirt floors with tarps that we know right now with the rain season, it's terrible. And then it actually gets quite hot. And then the housing becomes impossible also with the heat. So completely inadequate shelters. A lot of people are living in schools. So there's no education for the children because the IDPs are there. So, you know, I heard a story of like the women insisted that we go see the inside of their homes and told us that the woman next to them lost her baby the day before because she was unable to get to a clinic at night. So just, yeah, overall terrible situation. Also just hearing about how I think the same thing we were just hearing about DRC, that there's abduction happening for ransom. There's an increase in early marriage. There's also still like kidnapping happening where on the border with Eritrea, people crossing over and abducting women. Since there are no livelihoods, there's an increase of trafficking and young people, both men and women, who are leaving Tigray to thinking they're going to get some amazing job in countries like Saudi Arabia, and that not being the reality. And I think also just to mention that Fistula, there's a Fistula center in Mekelle, there's Fistula centers in different regions, but I think in the past, at least for me, I've been more aware of obstetric fistula, which happens with early marriage when children are basically giving birth. But also in Tigray and in Amhara and other regions, there is also trauma fistula happening where because of gang rape or because of objects being introduced into women's vaginas, there's a lot of damage that is done. And so the fistula centers are also supporting women for really atrocious situations. And so I just think that's also good to be aware of, that that fistula, at least in Ethiopia, has become a humanitarian issue and at different levels. And then also just to say, similar to Ukraine, there's a huge increase in intimate partner violence. And that is also with armed actors when they go home, based on the situation of stress and their own trauma and issues around mental health, and then seeing an increase in intimate partner violence. So I want to hand over to our colleagues in the field, and specifically the coordinator who's based in Mekelle but covers the whole Tigray, and then we also have our coordinator online from Shirde. So I'm going to hand over to you, Senait.
Yeah. Okay, Jennifer. Hi, colleagues. Thank you, everyone. It's a great pleasure for me to meet you all and discuss on the issues of the women and girls here in Tigray. Actually, most of the major findings of this mission is already stated by Jennifer. So thank you so much for highlighting the key protection risks that you've observed here in the region. So I can summarize with 2 slides all the findings here. So next slide, please. Yeah, thank you so much. So when we look at the background of this this mission, the OCHA reports that about 1 million of IDPs in Tigray with 82,000 returning in home are just is the data that we have just get from the OCHA, and out of this, about 17% are now residing in Shira. And also, although there is, this cessation of hostility between the federal government and the interim government of the Tigray region, still challenges persist, including the displacement and violence against women. And, as Jennifer stated before, there was also, this mission to Shira, specifically with the emphasis of visiting IDPs in their IDP camp, women and girls friendly spaces, one-stop centers, and also different meetings was also held with partners and government stakeholders. So during these meetings and visits, we have been trying to observe and to get different findings. And a focus group discussion was also conducted with the women and the girls in the IDP campus and the service points, like in the women and girls friendly spaces. So when we look at the findings of this discussions, with all these stakeholders, especially they stated that there are these vulnerable women and girls are in a severe challenges, in a severe situation, and it includes like they lack shelter, which exposed them to safety and security concerns. They also lack basic necessities, including like food, health, and the like. And there is no also comprehensive services, both from the humanitarian organizations and the government as well. Yes, and the GBV AoR partners also try to emphasize on the urgent need for the support of these vulnerable women and girls, so as to enhance the well-being and dignity of these vulnerable women and girls. And this need is also persist despite the absence of the gunshots in the region, the signing of the COHA agreement, as well as their continued exposure to various new forms of GBV is still persist. As Jennifer stated before, there are different new forms of GBV in Tigray that was not like before the war. Like, for instance, abduction, women trafficking, kind of new forms of GBV are also evolved in Tigray even after the COHA agreements. Yeah, next slide, please. Yeah, and when we look at the situation of the survivors of the conflict-related sexual violence, women and girls in the region are, they are facing complicated health issues and other concerns. Although the expectation of the survivors was to get a comprehensive service and access to justice after the conclusion of the agreement, in the ground, the reality is, the vice versa of this expectation. And, almost 10 to 12 partners in the region are obliged to shut down their service points, and and this is also due to the fund cut from the donors. But, the problems are still there, and survivors of the conflict-related sexual violence are using different coping mechanisms so as to survive their life. Like, for instance, child marriage and survival sex is still there. But I want to bring into your attention that the prevalence of gender-based violence in Tigray region is in an increasing rate, even in the post-war scenario. So it needs an attention and strong advocacy to be the voice for those voiceless women and girls in the Tigray region. So the key asks of these vulnerable women and girls are they are in need of an urgent assistance for the basic needs. They were requesting us, their primarily concern is having all this messed ups, they want to return back to their home of origin. But they told us before we returning back to our home of origin, we have to alive. And in order to alive, we need a basic assistance, like for instance, food, shelter, healthcare services, and wash services should be there, because especially this wash services like lack of dignity kit and sanitary pads also vital for the well-being of these women and girls. So they have, high need for such kind of services. And also they are asking for support in livelihood opportunities and economic empowerment to aid in their recovery and resilience. So these are the main asks raised up by the women and girls in Shira, representing actually almost all the vulnerable women and girls in the region. Even we had a mission, an interagency mission prior to this mission to southern zone of the region, and most of them are also have such kind of concerns, and they need the urgent assistance of these humanitarian agencies. So these are my presentation. Thank you so much. If you have any question, concerns, we can discuss.
Thank you so much. There is a question, and nice to see Pam Delargy on our call. She asked in the chat if you have any information on, now I just lost my chat question, on HIV, AIDS, and treatment happening in Mekelle in the hospital. Okay, hold on, sorry. I just had my question blocked. Okay. If you can discuss HIV as a significant issue, any attention to how survivors are referred to the center at either hospital in Mekelle, and yeah, if there's been some question around them able to access safe housing under this current situation of funding, which is a protection issue. Do you have any comment from there?
Okay, thank you so much for the question, Jennifer. When we look at the issue of HIV/AIDS, by the way, in Tigray, it's a pilot kind of test regarding HIV is, going on in collaboration with health, the Tigray Health Office here. So the result, some of the results that are just publicized, it shows that, it's in an increasing rate. The HIV/AIDS infection is an increasing rate, but it's true that during the crisis, there was an opportunity even to have the HIV test and treatment in hospital and clinics as well. But right now, there is an opportunity to get HIV/AIDS test as well as treatment for it. But it's the fact is that HIV/AIDS in Tigray is now in an increasing rate, and so many people are infected by this. This is a fact that we can find out in Tigray, and hopefully the assessment will be shared as soon as possible.
And just to add, I think this is one of the things that our mission really picked up on, is that the cases, women before were too afraid to seek services. And so now that the ceasefire happened, there are new cases of gender-based violence, but also women and girls are going to look for services, to seek services, whether that's mental health services or health services. And so there's actually increased demand for services at a time that the donor funding is going down. So the demands have gone up, the levels of resources have decreased, and that's creating a huge problem. Also, the visibility has been reduced, and as I mentioned, Amhara is feeling like they're not getting any attention at all, and they're currently in a situation of conflict. And we did see, for example, when I went to the mid-year review in Addis, I learned that last December, there were 76 partners working on GBV, and now there's only 47. And in Chile, we heard at that meeting that they had lost 12 partners already this year, and that's partners who had to shut down because of lack of services. And what we heard in Western Amhara is that you know, there's the access issues are so challenging, but also they're not getting the funding, so they aren't able to, there aren't partners there that they can work with. And so they're trying to increasingly find out what can they do with the local government. Also, there's 81 stop centers in Ethiopia, and there's the GBV AoR is working on doing an assessment, again, similar to what DRC did. They've been engaging with the Ministry of Social Welfare so that they also are seeing what the reality is. But the resources, they're quite resource poor. And so the different one-stop centers are supported by different NGOs or different INGOs or different UN agencies. And so in some, that might be that they get some dignity kits or they get some health kits. So it varies from one-stop center to the next, depending on who's supporting them and how much support they get. And we heard that in Amhara, for example, women are not seeking services because there's no services really that are adequate available at the one-stop centers. So this is a huge issue that was also raised by the humanitarian coordinator to look at, you know, what can be done. So other questions? Christine is asking about the World Bank funding. I don't know, Senait, if you can respond to that.
Yeah, there is a World Bank funding here in Tigray, and the donor is actually UNFPA. We have a project named CRR project, and it works on the resilience and recovery of these women and girls. So we have about 20 women and girls friendly spaces and also 7 one-stop centers and 3 safe houses supported by the World Bank project, which is named the CRR project. And, you know, we were providing, you know, until this September 15, and hopefully it will also continue providing service using this fund resource. This is the information I have.
Okay.
Okay.
Fauzia, do you want to ask your question? I'll read it out. But Fauzia has written that femicide in Ethiopia has been trending online. And is there something you want to share about this? Are there any cultural links to this? I'm not sure, Fauzia, which organization you're from. Maybe you could tell us? Okay, well, we're not here. I don't know if she's having problems with the microphone, but do you have any comments on that, Senait, about femicide in Ethiopia? Mm-hmm.
I think I have seen I was trying to check the chat box on the issues raised. Yeah, and I have seen that, you know, a question, have you noticed any indication of any forms of online prostitution? Is that for me? If yes, were any signs?
It says femicide in Ethiopia has been trending online. Do you have any comments on that, on femicide?
Yeah, actually, I don't have much information on this issue, but sometimes, you know, during the discussion with the partners, they were trying to raise issues related with this, but we don't have, you know, the actual kind of complaint or the actual data regarding on this concern. Yeah.
Okay, and then just answering Pam again about have we had discussions with GBV donors. We did do a debriefing at the end of our week with donors as well as with the HCT. And one of the reasons that we went on mission to Ethiopia was to give some visibility to the situation in Ethiopia, since we know that it has not, just because there's a ceasefire, the situation has not gotten to the point where there's no need and aid. We are going to present here in Geneva to donors during the UPR that's going to happen in November, not as part of the UPR, but at the same time, so that maybe there will be some people we could invite to present as part of our briefing to donors here in Geneva. So I think we need to move on. If there's any last burning question, I think we've answered the ones that are in the chat. We are going to have a report from our mission, which we can share. And yeah, like I said, we keep having other additional meetings. It was interesting to hear from OHCHR that they're actually participating in the cluster meeting. So they're in the protection meeting, they're in the child protection, in GBV, in other clusters. And I think this is quite an interesting model. It's something I haven't heard. I know that, you know, where there are the DPO missions, there's the WPE, the women, I'm terrible here on the acronyms. As the missions are closing out, there has, I think, been different roles that OHCHR has taken on. And we were told by the head of OHCHR in Ethiopia that they have a team of 30, which is quite large for OHCHR. And so I think it's something really worth looking at, how, you know, they've been doing monitoring missions together with the cluster to look at protection issues. I know specifically they've done missions together with the GBV coordinator from Addis. So I think that's something for us as humanitarians to look at more, like how are those collaborations going? And then just to say, there was a SURF underfunded allocation that came out while we were there. And I don't know if our being there and raising protection issues to the HCT helped at all, but there was funding under that has been designated to protection, to GBV, and the GBV portion has gone to UNFPA, UN Women, and OHCHR. So it'll be interesting to see how that work goes moving ahead. So there was some funding allocated under the underfunded portion of SURF. And I know they also had put in a SURF proposal related to the drought not too long ago. April, over to you.
Thanks so much, Jennifer and colleagues, for the briefing on both the DRC and also Ethiopia. Jennifer, you know, we've been having these discussions, you and I, bilaterally around, you know, the concerns of, you know, the rise in GBV in our various platforms to advocate, you know, for more funding, you know, for more response, you know, for more prevention, or, you know, what is it that we need? And I think it's great that you highlighted the, you know, I guess, a really dire situation in terms of funding, but also I'm really concerned around all of the increase in the prevalence and the forms of violence that women are now also exposed to, you know, as part of this whole deterioration in, you know, in the situation in country. So I just wanted to know, you know, and you've done the briefings for donors already, and probably also the HCT. Just keen to hear, you know, what is it that we, OCHA and others that are outside of the GBV space, can do to amplify and to support the messaging? What is it that we should be asking for? And I say this, I guess, because we do have the UNGA happening right now. So I don't know if, you know, if there's been messages to UNFPA and you know, the GBV, the GPC, UNHCR management and leadership in terms of, you know, what should we be asking for to really scale up if there is a need? Because I don't know if we're asking for a scale up of GBV services. Yeah, so I just, it's great to get visibility on the issue, but I think also I just want to have a bit more clarity on, you know, what's the call to action for us? I'm asking because I also have the OCHA Ethiopia colleagues constantly asking, what more can we do? What do you want me to do? And so some guidance on that would be really appreciated.
So, I mean, I think, you know, we heard a lot while we're there about the impact of reduction in funding, you know, which has impacted food, it's impacted services, it's impacted attention. So yes, funding is needed. Access continues to be a huge issue in Amhara. And yeah, I think they're working internally on improving quality of services. That's why they've been trying to with the one-stop centers. They just did this huge gathering of information about what is happening in each one. I did visit, and I forgot to mention this, the Women Girls Safe Spaces that were packed full of people. One run by IMC, one that was managed by Trocare. And, you know, we've talked about also, like, I only saw one stop center. It had amazing staff, 9 people, but it was empty except for one person. So I think there was also that question of, like, I only saw 1 out of 80, but, you know, that sort of the women, girl safe spaces I saw were packed full of people. So I think, you know, looking at also these models I know that the Riga from East Africa they just finished with a consultant looking very closely at 7 one-stop centers in Somalia to see like what's happening. And I know Catherine Polton's online, but in the past, you know, we've had this question around, are donors starting to fund one-stop centers more than women, girls safe spaces? Is that really the way to go? So I think, you know, we are using, Jessica from Nairobi is using the MNE tools from the minimum standards to look at quality. So I think, you know, the other thing I heard from Amahara is just how the protection cluster is working very closely together around prioritization, because the funding is so reduced that rather than it tearing them apart, they're actually working really closely to figure out how to prioritize. And I think, you know, the head of OCHA in Shire, it's the first time I've gone to a meeting where the first point that a head of OCHA raises is GBV. And he said he's worked in Gaza, he's worked in other places, and the situation of sexual violence in Tigray, he said, is the worst he's ever seen. Like he couldn't even express it. And that was the first point that the OCHA person raised. So I think you have very strong messages sitting in your desk. And I think it was clear that the GBV situation is, you know, like it came out in the IHA report, you know, it goes beyond what the GBV AoR by itself can do, or definitely it needs more resources to do. But I see that Pep has his hand up and he's the head of the protection cluster. So over to you, Pep.
Thank you, Jennifer, and for the good presentation of the mission to Ethiopia, and but also the presentation before, also very worrying on DRC. And on Ethiopia, also complementing on what you have presented, I mean, the GP situation is super grave. I mean, it's horrible, and is in all the reports that have come out from Ethiopia is there, and our mission was highlighted in each single meeting. And also it really goes beyond the technical capacity of the AoR, even the protection cluster, and maybe it requires also a whole system response. And I would like to, in addition to make sure that it has the required visibility on the ongoing situation there, also it also links to the protection strategy and the centrality of protection. It's one of the things that we discussed and will be in our briefing, our mission debrief on Ethiopia, on the ongoing work in the HCT on the protection strategy, and the need for the HCT under the leadership of OCHA to ensure the rollout and the monitoring of the protection strategy, and how we, through our weekly, protection interventions in the HCT, we can highlight and we can inform the HCT protection strategy. But also we need that those issues are taken to the HCT level, and there is collective response to the protection risks that we are seeing, being one of them, one of the most critical, GBV. So I think that we need to continue the work and to support the GBV AoR and what they are doing, and all the GBV actors in the field, but also to elevate it to the HCT protection strategy and to promote together with OCHA collective response. And also I would like to highlight how the current situation of the humanitarian funding being restricted, diminishing, how this is impacting and heightening protection risks. Not only that, there are less services to assist survivors or less activities of prevention, but also that the closure of many services is heightening protection risks. Anytime that due lack of funding, partners are forced to close child-friendly spaces, are forced to close support to IDP sites, there's a direct impact on the people and a direct risk on increasing GBV incidents. So also how the lack of funding together with the lack of solutions is also increasing GBV risks. And there's also another point that we will try to highlight on the lack of nexus and how this is impacting on a dramatic increase of protection risks, in particular on GBV. Thank you.
Thank you, Pep. And I think, yeah, April, this is definitely an issue we need to continue to discuss. And because the reality is funding is going down, and I think OCHA has made it very clear that asking for more is not going to necessarily lead to more. But I think we also need to be very clear about what the needs are and not reduce the visibility of needs so that we can meet our targets. I think we still need to be very honest about that the situation is getting worse, not better. So we need to move on. So I'm going to hand it over to Claire, who's going to share about new resources on child marriage. Over to you, Claire.
Thanks so much, Jennifer and colleagues. Let me just check. Valentina, are you going to share your screen or do you want? Yeah, perfect. Thank you. Let me turn my video on and say hello. Just wait for the slides. I'm also joined by my colleague Amel, and she's actually going to kick us off. So I suppose, Amel, you can, over to you first. Thanks.
Thanks, Claire. Hi, everyone. My name is Amel, and I work with UNHCR in headquarters. I am the global focal point for gender-based violence against children and have been working with Plan International for the 4th phase now, Claire, on the issue of child marriage. As you know, we do have a memorandum of understanding collaboration with Plan International on adolescent programming and also specifically the issue of child marriage. And this collaboration actually stems from this memorandum of understanding. The tools that Claire will be presenting now, as I mentioned, are the result of 4 phases of collaboration with Plan that actually started with support to specific situations and mainly refugee situations. But the tools are made in a way that can be adapted to any other humanitarian situation and specifically when displacement is involved. So I'll hand over to Claire to walk you through the different tools we've developed together. And yeah, I'll be posting some of the links on the chat for everyone.
Perfect. Thanks so much, Amel. And I'll try to be really succinct because I know that we're a bit short on time today. So yeah, Valentina, next slide, please. Oh, sorry, I'll introduce myself first. My name's Clare Lofthouse. I'm working with Plan International as a GBV technical advisor sitting in our child protection team. And as Amel mentioned, I really want to share sort of 2 buckets of resources with you that we've recently published. One is about is a toolkit on conducting context analysis, specifically on child marriage. And the second one is looking at strengthening our response to child marriage through case management. So yeah, next slide, please. Yes, so we recently published this toolkit. It's available online in English and French, and hopefully Arabic is coming soon before the end of the year. It's really a toolkit to really help you to really unpack and dig more deeply into the practice of child marriage, and also to understand the capacity of the staffing and the current response in order to be able to manage, to respond to it. So the goals of using these tools are an outcome, if you do a context analysis, is, you can really use them to strengthen your existing programming, help you to define future prevention and response actions, and also tailor your advocacy and what's there in that practice settings, things can change quite quickly. And so it's important to be able to keep a deep understanding of how child marriage, which can be quite complicated, can be affecting the pressures on girls and their families. You can use these tools in this toolkit or this process and approach to complement needs assessments you're already doing, existing literature reviews, standalone studies or gender analyses. So you can kind of pull from it what you need or do a fully fledged context analysis. We developed this toolkit based on having a sort of a draft version that we then piloted in a few countries in, I think Amel mentioned, Niger, Bangladesh and Indonesia. Oh, that's my doorbell, just 1 second. Hang on.
I don't think we can actually hear the dog very much.
It was my doorbell, sorry.
Oh, okay.
I'm so sorry for that delay, very, very live. So what I was saying is the rationale for having developed this toolkit is because as child marriage is a form of GBV, and we know that it can become quite complicated, and in some settings, it's still not necessarily seen as an issue for humanitarians to be addressing, given that it's associated to all these sort of traditional, cultural, religious, ancestral practices. But we also know that crises and development settings always elevate the rates of child marriage. And so being able to navigate these quite sensitive conversations, we felt that was still a gap in what's available. So that's why we've developed these resources, and we really hope that they're useful to you. So I'll just unpack them for you a bit. So next slide, please. So inside the toolkit, it's split into 5 steps. The first one really helps you walk through what do you actually need to do. And it helps to establish whether you need to do a full data collection, or perhaps you already have a lot of data where you are and it's just more a matter of synthesizing it. You will then have a step to look at your literature review, which you will always need to do. And then, as I mentioned, an optional step on how to collect primary data when we're dealing with an issue such as child marriage, which is very sensitive. And sometimes we even need to collect data about child marriage without asking about child marriage because of some of the sensitivities in the contexts we work in. So how do we do that? And then step 4 is all about analysis and validation. And so we really recommend that you go through at least one stage of validation, whether that's you present the findings to the actors working in that area, so with your staff, or if you have time, capacity and security allows, back to the community. And then step 5, which is all about publishing and dissemination. We have also developed kind of an adapted socio-ecological model to help frame this whole process. I don't think I'm going to go through that because I think everyone on this call knows what that is. But just to say that we have added an extra layer, which is looking at humanitarian capacity and coordination. And the reason we've added that in is because we have found that there are, unfortunately, sometimes unintended consequences of the humanitarian response, which can lead to risks or accidentally encourage or condone rates of child marriage. So we've kind of added that in because it's important, and also because we felt that for follow-up steps, a lot of the time we need to do capacity building, and that needs to fit in somewhere. And so we've kind of put that there to draw a bit more attention to it. Yeah, next slide, please. As I mentioned, it's not necessary that you have to collect primary data. You can do a simple literature review, and there's different layers of data collection if you want to do that. And each of them is going to be dependent on how accessible your community is and what's safe, and also what gaps there are in the data. If, for example, you're going to do this in Cox's Bazar, there's so much literature from that context, so much has already been written that you really need to pinpoint the gaps, and you might not need to collect primary data. And then also thinking about how to do a mapping of capacity among CP and GBV, so that you also have a good understanding, that you come up with recommendations and follow-up actions that make sense for the capacity of that response, because that needs to be practical. And there's also a bunch of tools and templates in there that you can use and adapt to your setting. Next slide, please. One of those tools I just wanted to draw your attention to, which I think is really helpful, is called the What We Need to Know About Child Marriage. And this is a sort of a compilation of, and it follows that socio-ecological model that I showed you earlier. It's a compilation of different information that might be helpful for you to consider to collect in your setting. You don't need to do it all. It doesn't all need to be collected, but it kind of walks you through different information that can feed into that full picture of how is child marriage happening where we are, the pressures, the drivers, the risks, and the protective factors, so that you can consider how to include all those things in your research, and also perhaps pinpoint where you can get information that you might not have thought of before. So that's in there just to help you, and just wanted to draw attention to that. Next slide, please. Yeah, so we've developed also some resources on case management. These are, there's 3 of them. There's a learning paper which captures what we did during our piloting phase, what we learned, and then some recommendations or actions about how we can then take this forward. And yeah, we really published this learning paper as to kind of serve also as a springboard for us to have conversations about how do we improve this, because we always talk about women and girls when we talk about GBV, but we all know that the girls typically don't get as much attention as they should. And then coming at it from a child protection perspective, we also sometimes miss out child survivors of GBV. So again, we end up with this sort of gap between these 2 big areas where girls continue to fall between the gaps. So we really wanted to also publish this very honest learning paper in order to then stimulate those conversations. And yeah, of course, try to more effectively meet the needs of ever married girls as well as unmarried girls. And as I mentioned, it's based on working in those 3 different locations, the context analyses that we did in those places, as well as different activities like trainings, workshops. We piloted looking at case management forums, where at sub-local level in Niger, they brought together all the different actors, including government actors, to try to identify challenges and brainstorm solutions. So it's really building off of what we were already doing in our standard practice, plus some piloting. Yeah, and on the right side, there's just some information there about yeah, the impact of child marriage on displacement settings, but I will just skip over that in the interest of time for now. Oh, next slide, please. So what's inside these resources? As I mentioned, there's 3 of them. One of them is a learning paper which walks you through how displacement affects child marriage. The second one is looking at common challenges when handling cases of child marriage, again, based on those analyses that we did across those 3 settings. And then what we did in our piloting, it talks you through those activities. And then it summarizes this through 7 key learnings, 19 actions, which is a lot, a lot of things that we could be doing. And so in order to try to make those actions a bit more practical, we developed a checklist, which is another one of the resources. So I'm going to walk you through that in just a second. But just to say that if you don't have time, and of course all of us are always limited on time, there is a summary version of the learning paper. So I think it's just like 6 pages if you just want to read it quickly. Yeah, next slide, please. So as I mentioned, we tried to make those actions a bit more practical. And so we created these checklists and we sort of delineated them into different groups of staff working across case management. So caseworkers and volunteers, supervisors, and then global national leads and coordinators. They're sort of written through statements that you can consider, and you can think about how this is applying to your work. Conversations you may want to have with supervisors or with teams to stimulate kind of solutions orientated responses to them. And there's also some examples and scenarios in there to kind of think through how you would handle that case where you're working. We really, really welcome your feedback. As we mentioned, this is really just based on our evidence and our learning. But if you use these, or if you have ideas of how we can improve them, or if you use them and it worked well for you, please do let us know. We're always curious to hear that as well. And then the last slide, I think, next one. Thanks. Yes, is there anything else coming out of this collaboration between Plan and UNHCR? And the answer is yes. So we've got some e-learning, we've got a short e-learning series that's going to be available. In fact, I think the first module is going to go live in the next week or two. There's 3 modules, one of them all about child marriage. One is looking at adolescent girl responsive programming and how that's important when we're responding to child marriage. Second one is on case management, and the third one is on prevention. So we will be sure to circulate those with you when they're ready. We've also got 2 animated videos that are essentially there to kind of explain what we can do about this issue across humanitarian response, as well as to draw more attention to it. And we're in the process of developing an advocacy note aimed at country teams that you can adapt to speak to your donors, to work on in your program strategy, etc. And then if you're working for UNHCR Plan, or you're one of our implementing partners, you can contact us through our help desk function, and that email is on the screen. Unfortunately, that is limited to just us at the moment. We're still sort of piloting that, and we're working with a number of countries like Jordan, Mauritania, Morocco, Yemen, and one more, which I feel terrible now I've neglected. Yes, hopefully we'll have some more details on how those resources are going in the near future. And if you want to get in contact with myself or Amel, I've put our details on the last slide. And yeah, thank you so much for giving us the space, and looking forward to your feedback on these resources, and happy to answer any questions.
Thank you, Claire. I know you've been waiting to present this for a couple of months, so I'm really glad that you were able to do so. There is a question from Justin. Can I just say it's really exciting that we've had so many child protection questions during the session. I feel like we've gotten both the CP and GBV actors together here. There's a question also about the GBV case management guidelines that are being updated, not revised, but updated. And it's mentioned that there's a chapter on child marriage case management. And so there's an ask if you have collaborated on this.
Yeah, thank you. Yeah, both Amel and I are involved in that process, so we're really happy to be part of that. Yeah, thanks.
That's an advisory group, right?
Yes, and as an advisory group, yeah.
I think Christine Appio has left, but Catherine Fulton from UNICEF is here, so I know that there's a number of you from the core members that have been part of this advisory group. Catherine, did you want to say anything?
No, I responded to Justine's point, sorry, saying that yes, we're working closely with Claire and Amel on making sure that we're dotting the dots and whatever the terms are, and working very closely. And yeah, that's it.
Thanks. Yeah, and just to say, we do, these are the kinds of issues that we raise in our annual meetings as our core members, and this helps us also stay coordinated, I think. So, and I noticed that Pep had his hand up, because as we know, protection has also been working on case management. And Pep, just for your information, Claire is one of our core members who has been part of the process, at least, for that. But over to you, Pep.
No, sorry, it was an old hand from the previous. Sorry.
Okay, great. So any other questions that I might have missed to Claire or Amel? And just to say, I think, we have come a long way in recognizing child marriage as a humanitarian issue, not only as a development issue. And you made me want to find out more about how humanitarians are actually making the situation worse in some cases. So I will follow up with you bilaterally on that one. But yeah, I think issues like child marriage, FGM, and fistula have been seen in the past as more development issues. And unfortunately, we've seen increase in humanitarian settings and needing to look at how we address these issues in a humanitarian setting. So this is great that this tool is, that you've been piloting it already for some time and are able to share it. And actually, I didn't want to miss, we did have one comment in the chat. Wait, sorry, I'm not very good at maneuvering all of this. From, just because it was very nice. Regina Osalulio, she says, good afternoon. She is from the South Sudan Ministry of Gender, Child, and Social Welfare. And she finds that these tools are very important and all the information is great, that she's learned a lot. So it's nice that we had someone from the Ministry of Social Welfare from one of the countries that we work in online. So we can see if you can follow up with her afterwards. Maybe you can add countries to your list of pilots.
Actually, actually, it's really great to hear from you, because I will be in South Sudan in October as part of this ongoing collaboration. So I look forward to being in touch and meeting you there. So
that's great, great news. And then Catherine also wrote that the GBVMS team is also working on the case management piece that's being developed together with Clare and Amel. So good coordination all around. And Hira, for you, moving to you, and thank you all who did block your calendars for 2 hours. Like I said, we knew it was an ambitious agenda, but Hira is going to be talking about another invisible emergency, which is the flooding that has been happening in Maiduguri in Nigeria. And I know I had written to our core member, who is a women-led organization in Maiduguri, and she sent me back a picture of basically a river in front of her house with a boat going by. So I did think it's good to give some visibility again to another country that's not receiving global media attention. So over to you, Hira.
Thank you so much, Jennifer. Good evening to you and colleagues. And thank you so much for giving us the opportunity to share what is the overall situation in terms of floods, what has been our GBV response by the partners, particularly in the Borno state, which is mostly impacted by floods, and what are some of the key GBV risks and some of the recommendations. So if you can please go on the next slide. Now, giving a little bit background, this year, the flooding has impacted Nigeria, not only the northeast Nigeria, which is has been impacted by conflict over more than a decade, but there are about 30 states out of 36 states which have been impacted now, which has also displaced around 1 million people in the whole country. But coming down to northeast Nigeria, which includes 3 main states, Borno, Adamawa, and Yobe, the flooding has caused around internal displacement of about 0.4 million, 400,000 individuals within the 3 states, particularly in Borno, as I mentioned earlier. And now because of the floods, these people have moved to the main 3 locations, as we call local government areas, such as MMC, which is Maiduguri Metropolitan Council, Jere, and Kondoga LGS. Now, with this flooding, this has not only resulted in protection issues, but also increased sexual violence cases, including such as rape, and then some of the GBV risks, which I will talk about shortly. So looking at the main risks, if we look at the camps that have been assigned or approved by the Borno state government, the situation is a lot chaotic, and also because the camps that we had in the past due to the Boko Haram crisis have also been closed down. Now, people coming from the flood-affected areas have come to these approved camps by the government. Now, the conditions over here are extremely overwhelming in terms of safety, security, wash services, insufficient health services, insufficient food assistance, There have been extremely dirty in terms of the place itself. You can see open defecation by people. There are no safe spaces at the moment, women, girl safe spaces. There are no latrines. And if there are some latrines, they're not again separately for women and men, and there are no proper lighting. There has been no patrolling of the security personnel by the government. So it's very limited, which has led to increased GBV risks, which has been shared by the through the partners that we have on ground at the moment. If you can go to the next slide, Jennifer. Now, as a response, what we have around like 25 partners who are already on ground on implementing GBV prevention and response services. These partners have been in these areas, not specifically for for response to floods, but they are technical enough to immediately provide life-saving services, which includes GBV case management services, providing referrals, distributing dignity kits, setting up protection help desks, then social support services, which include also PFA, establishing mobile women and girls safe spaces. And given this safety security issues within the camps, some of the partners have also deployed female gender desk officers. These are some of the immediate response that has been done by partners, which I believe is a great achievement, because this is the third week since we had floods, which happened on 10 September. So the partners were quite efficient enough to immediately respond. At the coordination levels, we've been participating in the multi-sectoral needs assessment that has been led by OCHA with the Borno state government. This has not been undertaken at the moment, since the tool has been is with the government for the final review and endorsement. However, GBV related centric questions have been included within the protection sector, around like 10 questions, and also within the other sectors such as wash, health, education, food, and so on and so forth. Again, it's a great achievement, because usually GBV AoR has very limited space with just addition of like 2 to 3 questions. However, in this upcoming assessment, we were able to have like around 10 questions dedicated to GBV prevention and response. Then, of course, we've been raising the key risks within the ISWG meetings led by OCHA within the protection sector, and also the coordination meetings that have been organized by the government. And then lastly, some of the partners have also been organizing quick orientations on PSCA, on GBV, including like how to respond to GBV disclosures and GBV referral pathways. And lastly, again, we've also been having coordination meetings from the start, I think that was the following day since we had the floods, coordinating with the partners. So we initially started with the twice with like bi-weekly meetings, but now we've started to have one like a weekly meeting every week, just to share information and to discuss any challenges that require support within the GBV partners or from the government or other sectors. And then we've also had SITRAPs, the situation reports for the GBV AoR and also for the ISWG. So far, we have disseminated 3 SITRAPs. Now, can you go to the next slide, please? Now, one of the great challenges, the major challenges that we've been having is the resources, because as I mentioned, we were not anticipating floods to this scale in Nigeria. And also within Northeast, this flooding has never happened in the last 30 years. And it was basically due to the collapse of the dam that we have in Maiduguri. So there was no early warning by the government to the communities or sharing with the sectors or OCHA. I mean, there was no forecasting. So there is also less preparedness funding that partners have allocated within their conflict response. So what we've been doing is also raising it with the NHF, which is the Nigeria Humanitarian Fund. So the key financial asks so far is 2.2 million for both child protection and GBV as we work together for GBV prevention and response, and 1 million for both integrated SRA GBV intervention. And yesterday we've received the allocation strategy from NHF. So the funding which will go to GBV only is 0.5 million. And looking at the promoting also the localization agenda, we have selected 3 local partners, RHHF, Baudi, and JDF. 2 of them are women-led organizations. And then we've also been providing technical guidance to the partners on rapid response fund that has been led by IOM, and most of the donors do provide rapid humanitarian assistance of about 3 months, from $300,000 to $500,000. So there are GBV partners and other sectoral partners that have been planning to have GBV interventions, and also integrating GBV in other sectoral interventions. Then we have also been having we organized a donor meeting in Abuja that wasn't specifically for floods, but a yearly donor meeting that we organized with protection sector as lead, and we took the opportunity of sharing it with the key donors that are also providing financial support to the Northeast Nigeria partner GBV subsector partners on the funding gaps. And there have also been some of the requests from GBV partners on reappropriation, which the donors have been quite generous and efficient about it, which also helped the partners to immediately respond. Can we go to the next slide, please? Okay, now these are the 3 SITREPs that I mentioned that we have released. One on the following day of the floods, which was within 48 hours as per our global guidelines. And then in the same week, we issued another one, and one we disseminated last week. Again, this is something that we've been sharing it with all sectors at the ISWG and also within the partners. Can you go to the next slide, please? These are some of the other products. As I mentioned earlier, we've also updated the hotlines that we have on GBV case management. So we've developed a flyer for partners and also to be used as a sticker, placing it within the camps. So for any GBV incidents, the support that the partners can provide, including some of the facilities or clinics that we have, which are providing clinical management to rape, and for accessing legal aid through the female desk officers, and also including the government SART centers. Then we have been sharing it, been contributing to the GBV, to the OCHA flash updates that they're sharing on a weekly basis, as well as the protection sector update. And lastly, we also revised a handbook on key messages on GBV, SCA, referrals and hotlines, which I've shared earlier. So it's a compendium of different posters also translated. Some of the posters have also been translated in local languages like Hausa and Kanuri. So this is it because prevention is also very important. We've been developing these posters in the past, but we consolidated and made it as like a handbook with all the posters with local languages. Can you go to the next one, please? Then we also did service mapping, again, finding out who are the partners that are working within these camps, not only the GBV subsector partners, but also the other sectoral partners like WASH, CCCM, food, to raise the needs of women and girls in terms of WASH, food, safety and security, and so on and so forth. We've also done GBV safety audits within the selected camps that have been approved by the government, and we will be analyzing the findings from the safety audits from these 28 camps this week. Then yeah, and then the safety. This is just a snapshot of those safety audits and service mapping that we have undertaken. Can you go to the next slide, Jennifer? Now, this is a success story very quickly, like one of the camps, which is within Maiduguri. It's called Bakasi camp. There was one clinic, it's called Sulumri camp, which is like 3 kilometers from the Bakasi camp. This has been initially established by UNFPA. And from this year, NHF, Nigerian Humanitarian Fund, continued providing the services through RHHF. That's another local organization, GBV subsector partner, who's been providing GBV and SRH services in this camp. And within the first week, they have been receiving women and girls subject to violence and also with SRH issues. So given that this was just 3 kilometers away and have been established within the vicinity of the areas which are being impacted through prolonged 10 years crisis, they were able to provide immediate life-saving services to Mina Gemba, which is of course not a real name. She was pregnant and she started having breathing issues and what do you call it, shivering and so on and so forth. So with this camp, the people, the case managers and the midwives that have been trained were immediately able to support Mina within a couple of hours, and she was sustained enough and was released through the clinic. This was only possible because some of the preparedness actions that GBV partners have been undertaken in last 2-3 years, and now with the impact of flood and having flood affected people within the 3 kilometers of this clinic, this was quite an achievement with the funding that this partner had received from Nigerian Humanitarian Fund. Can you please go to the next slide? Now, the recommendations is we have been doing at different levels. For example, to donors with the increased funding, the donor meeting that we had last week mentioned that we are doing the safety audits and some of the assessments and service mapping, and based on the findings, we will be developing funding appeal to different donors in a package of hub and spoke, which has already been replicated in Nigeria through RHHF, and we will request for donor funding for some of the partners that are on ground, particularly women-led organizations. Then, of course, to subsector partners on prioritizing the key activities, which is establishing women safe spaces, women and girls safe spaces, focusing on mental health and psychosocial support, and also having mobile teams, given the the responses within the camps. Not it includes hosting population, but at the moment we are all focusing on the camps. So mobile outreach is extremely important. So this is something that they are also prioritizing within their within their response. And then at the ISG level, the GBV key messages that we've developed, the posters with the hotlines, and also the handbook. This has been shared with the different sectors, and they've acknowledged that this was extremely important given the increase in sexual violence cases and the GBV risks within the camps. And with the government, the same, we've been advocating on the issues, the GBV issues within the camps, and also the cash assistance that they are prioritizing for flood affectees, to include women and female-headed households within their cash assistance. So this is it from my side. Thank you so much, Jennifer. If there's any question, I would be happy to answer. And thank you for staying so long till the end. Thank you.
No, thank you. And 40 people have stayed on. So everyone took us seriously when we put a 2-hour block into the agenda. So thank you all who blocked that much time and have stayed on. Are there any questions for Hira? Just, I also didn't want to ask Hira to wait, because I mean the flood situation is now, and Hira, you've clearly done so much work, and there has been so little coverage, again, in the media. I wanted to call your attention to, in the chat, I asked Pam Delargy, who actually used to be a rep in Sudan and in Ethiopia and in Eritrea. So she's quite familiar with the region and now is at the university in Arizona. And they're having a webinar tomorrow that's about Tigray, and she put it in the chat on health issues. So maybe she'll be covering that HIV question that was asked. And then I also noticed that Gina was online, and she is from Switzerland, worked with IFRC for a while, and has been about 6 or 8 months now in DRC. And I've asked her if at some point she's been focused on PSS, NHPSS services. So I'm hoping she'll be able to present something in the future. And yeah, if I don't want to go over our 2 hours. So is there any burning question for Hira or for anybody else? A question that we might have missed in the chat, or any burning question that you have? So, and it was nice to have Pep here from the protection cluster. I think this was might have been his first GBV AoR call. So I think we got so much good information in this call, and it's a lot to assimilate. So we will put it all together, all the different PowerPoints and the briefing notes. I think we can get all the briefing notes that Hira just mentioned. They all look really well done, and I'm glad that you've been getting traction. Nigeria is one of the countries that Christine Appio worked in with the call to action roadmap some years ago, and I think GBV is seen by the HCT as a critical issue in Nigeria. And actually DRC was the other country that was under the ECHO funding for call to action. So thank you all for staying on. I don't see any last minute burning questions. So yeah, and it was great to have engagement from other sectors, and I think we need to make an effort to have more child protection actors on these calls as well. I felt like the contributions were very positive from looking at those intersections between child protection and GBV. And actually, just to add on that topic, in the call that we had today with Amahara, we learned that the GBV and child protection have one working group. The TOR includes both. And this is because out of the more than like 1,500 cases that were reported, 750 of them were children cases. So again, critical to be working together. So thank you, everyone. Thank you for staying on the 2 hours. And I hope you benefited in some way from the call. And let's really need to talk about how we can continue to plow forward in such a dire funding situation and keep doing the work that all of you do. So thank you all for your work, and thank you for joining the call. Bye.